Good day to everyone. My name is Francis Mwanakasale, your lecturer who is going to take you through mental health and psychiatric nursing. So today's topic is from mental health as a course. We'll be discussing some mental disorders characterized by a disconnection from reality. And these are psychoses. That is unit 3.3, where you find some affective disorders like mania, bipolars, and depression. Not forgetting schizophrenia and dementia. So today's discussion is specifically on dementia as a psychosis. Now, what are the objectives of this tutorial before we go any further? The general objective states that at the end of the lesson, students should be able to acquire knowledge on dementia and how to manage it. Then a specific objective states that at the end of this discussion, the students should be able to define dementia. They should also be able to discuss the 4 key elements in dementia. They should also be able to state the causes of dementia. Students should also be able to describe the types of dementia. The students should also be able to list the signs and symptoms of dementia. And finally, the students should be able to discuss the management of dementia. When we talk about management, we are referring to the following components. Students should be able to come up with investigations done on a client with dementia. 1. Students should also be able to come up with the drugs that are used, especially the dosage for the drugs, the frequency on how frequent they are given, the duration, and some side effects, not forgetting the mechanism of action for each drug that the student has come up with. Finally, students should be able to come up with the nursing care for someone with dementia that is under the last objective, which is management of dementia. Now, introduction. So poor memory and disorientation were once considered a normal part of aging. Hence, it was believed that if one lived long enough, such impairments like dementia are unavoidable. So meaning that whosoever lives too long, above certain ages, they may be likely to develop dementia because of tissue degeneration. Just like any other tissues degenerate, the brain tissue equally does degenerate. So meaning that if the brain tissue degenerates, there will be some dysfunction in the way certain activities of daily living will be carried out because of an impairment in the functioning of the degenerating brain. So dementia is considered an abnormal state with many causes that can often be identified. Now, what is dementia? Let's get the first definition. Dementia is a deterioration of intellectual function and other cognitive skills, leading to a decline in the ability to perform activities of daily living. Intellectual function. What is this intellect we are referring to? The way someone understands and reasons objectively, especially to do matters to do with abstract. So people with dementia, you find that they end up having a deterioration in the intellectual function. Also cognitive skills, the way someone, when we talk about cognitive skills, we are referring to the way someone processes thoughts. In dementia, individuals don't process thoughts in an expected way per given society. So once there is a change or deterioration in the intellectual function and the cognitive skills, then you expect to see someone failing or not performing the activities of daily living as expected. What are these activities of daily living we are referring to? If you remember very well in your nursing career, in the fundamentals, you discussed the nursing models. Amongst them, you discussed Peplau's model. Another model is for Virginia Henderson. Another model you looked at is Dorothea Oriem's self-care model. Another model you looked for, or you looked at, was for Loper Rogan and Tieni. I'll pick this one. These guys, they looked at the activities of daily living as in being 12. Just to mention, one of the activities of daily living, according to Loper Rogan, was that one must be able to maintain a safe environment. Now, someone with dementia, because of deterioration in the intellectual functioning and also deterioration in the cognitive skills, they will not be able to perform all the activities of daily living as expected per society. That is the first definition. The second definition says dementia is the total intellectual decline of sufficient severity to impair the social or occupational functioning that occurs in normal consciousness. What does this definition tell us? It simply tells us that dementia occurs while someone is fully conscious, unlike delirium, which might involve adjustment in someone's consciousness. In delirium, someone may be in stupor or in coma, but dementia occurs while someone is fully conscious. They've still spoken about impaired social and occupational functioning. Someone with dementia may not associate with others as usual, easily. They may have some social impairment. Someone with dementia, if they had an occupation, they may not perform their duties as expected because they have dementia. In simpler terms, it's because there's a deterioration in the intellectual functioning and the cognitive skills. Let's look at the third definition for dementia. The third definition says it's a progressive decline in cognitive function due to damage or disease in the brain beyond what might be expected from normal aging. So this definition tells us that dementia is a progressive decline in a cognitive function. What would cause this decline? The damage or disease in the brain beyond what might be expected from normal aging. And then someone will end up having dementia. So the key terms there are that someone with dementia will have deterioration in intellectual function and the other cognitive skills. This will lead to someone now failing to perform the activities of daily living. Another definition says this is a significant and persistent loss of cognitive ability in a previous unimpaired individual, which is not caused by the normal aging process as a result of abnormal cerebral brain function, which may be due to physical or structural damage to the cortex or alteration to the cerebral neurochemical function. So if someone didn't have dementia initially, then you notice some deterioration in the intellectual skills and also cognitive skills, then you can say that person actually has dementia. Now, initially we mentioned that there are 4 key elements in the definition of dementia. What are these 4 key elements? Once you notice some of these in someone with dementia, then you can actually say someone has got dementia. So there's global impairment. What is this? Dementia impairment in our total, the impairments occur in more than just memory. Most dementia patients experience impairments in reasoning, using and understanding language, recognizing what one perceives through the senses, coordinating learned motor movements, planning and decision making. Those are the components that we can find under global impairment. If you find a number of those components deteriorating in someone, then you can say someone has got dementia. Decline. What is this decline? If someone was able to perform certain activities of daily living nicely before they had dementia, once they develop dementia, you expect a decline in the performance of those activities of daily living. So the impairment represents a decrease from a previous level of function. To recognize a reduction, it is crucial for the nurse or any medical personnel to know the patient's previous level of functioning, unless members of the family or significant others give correlated information. That's why it's very important as nurses, as you try to diagnose dementia in a client, you don't only get information from the client themselves, you can also get history from the relatives, especially those that have lived with the client for some time. They'll be able to explain to you some deterioration they have observed as they were living with the client. So at least there should be a decline in the way they perform one or two activities of daily living. The first one we've mentioned is global impairment. That is in recognizing what one perceives through the senses, coordinating learned motor movements, planning and decision making. Or there should be a decline in the performance of one or two activities of daily living. Then you also look at the severity. Impairments are severe enough to interfere with normal functioning in everyday life. Example are a person who was living independently and begins to make poor financial decisions or forgets how to cook a meal. Then you may start beginning to suspect maybe someone has got dementia. Although the person could previously perform these tasks, then they just begin to fail. Or sometimes this person might be getting lost while walking from a nearby church or nearby place, which they can easily identify and know their direction getting home when the individual is okay. The other thing to look at is normal consciousness. If someone has got presents with failure to perform certain activities of daily living, whilst they are fully conscious or their consciousness is normal, then you can suspect this is dementia. Because remember, I've mentioned in delirium, the consciousness deteriorates also. They may be in coma or stupor. However, in dementia, the consciousness is normal. So what are we saying under normal consciousness? These impairments occur in a normal state of consciousness. Patients are fully awake and alert. This is distinguished from an abnormal state of consciousness such as drowsiness, stupor, or coma, which are seen in delirium. Now, let's look at the causes of dementia. The causes of dementia can be classified into two main categories, which includes primary causes, and there are also secondary causes. Let's look at primary causes. In primary causes, dementia is the major sign of some organic brain disease, not directly related to any other organic illness. One of the causes of dementia under primary causes, we have Alzheimer's disease. This is due to the shrinking of the brain and the decrease in the number of functioning neurons. So Alzheimer's disease, this disease comes when someone is actually aging. We'll discuss more in Alzheimer's disease. For now, know that Alzheimer's disease is a cause of dementia. The other one is vitamin B12 deficiency. So this is because of the absence of vitamin B12 in the body, which can cause degeneration of the brain cells. So lack of vitamin B12 can also cause dementia. Then there are secondary causes of dementia. Under this type of causes, dementia comes as a result of other illnesses related to the brain. There is brain injury, which usually happens in head injury. When there is an injury to the brain cells are damaged. This leads to brain cell degeneration. Then someone begins to develop dementia. Chronic alcohol abuse. This is due to the toxins which are present in some alcohols, which causes damage to the brain. HIV infection. This is due to the damage that the virus causes to the brain. Then other causes like Huntington disease, which is a rare but inherited disease, which can cause progressive breakdown or degeneration of the nerve cells in the brain, meaning it can also lead to dementia. Under other causes, we still have Parkinson's disease, which is a progressive nervous system disorder that affects movements. We also have alcohol consumption, which we already mentioned, and also Creutzfeldt-Jakob disease, which is a rapidly progressive neurodegenerative disorder believed to be caused by an abnormal isoform of a cellular glycoprotein known as the prion protein. This also damages the brain. Now, let's look at the types of dementia, having gone through the causes of dementia. Now, number one type, which is the most common, is Alzheimer's dementia, which caters for 50% of the clients with dementia. Then we also have vascular dementia, which only caters for 10% of the patients with dementia. We also have frontotemporal dementia, which caters for 15% of the patients with dementia. We also have dementia with Lewy bodies, which also caters for 15%. The remaining percentage is catered for by what we call mixed dementia. Now, let's talk about these types of dementia one by one. Let's begin with Alzheimer's dementia. This is the most common type of dementia, accounting for 50% of all cases, like I have already mentioned. Alzheimer's dementia is an incurable neurodegenerative disease. It is an acquired disorder of cognitive and behavioral impairment that interferes with social and occupational function. Meaning that once someone has got Alzheimer's disease, there can be some damage to the brain tissues, which disturbs someone's intellectual functioning and someone's cognitive skills. Hence, if someone is working, then there will be an impairment in the occupational function. So it is an incurable disease with a long and progressive course. What happens there is that plaques develop in the hippocampus. What are these plaques? They are more like accumulation of degenerative proteins in the brain tissue. What is this hippocampus? This is a structure deep in the brain, in the temporal cerebral cortex, which help to encode memories, and in other areas of the cerebral cortex that is used in thinking and making decisions. That's why someone with Alzheimer's disease, usually they will have the loss of memory as one of the first signs and symptoms to show, because of the damage to the hippocampus, which is found in the cerebral cortex of the temporal lobe of each individual. By the way, this hippocampus is found on both in both hemispheres, that is the left and right hemisphere of the cerebral cortex of the temporal lobe. So any damage or degeneration to this hippocampus, then someone, usually this damage is caused by the plaques, and someone will develop Alzheimer's dementia. The second type is vascular dementia. From vascular meaning coming from blood vessels. It accounts for 10%, like I have already stated, of all reported dementia cases. It is caused by impaired or reduced blood supply to the tissues of the brain, resulting in oxygen and nutrient starvation of neurons, and the tissue necrosis occurs. What are we talking about? You and me, you recall that the secallus arteriosus in the brain, if you remember your anatomy very well, it plays a role. The blood vessels of the secallus arteriosus, or the circle of Willis, play a role in supplying the brain tissues with blood, which contains the nutrients and the gas like oxygen it requires to form energy. Now, if there is any blockage which leads to some brain tissues becoming ischemia or becoming ischemic, then those brain tissues that are ischemic, they'll be deprived of the nutrients and the oxygen that they require to form energy, meaning that their survival begins to deteriorate. Eventually, if there's this continuous lack of supply of these nutrients and a gas like oxygen, there will be tissue necrosis. So reduced blood supply is caused by clots. If the clot blocks the blood flow in the end of the blood vessels of the circle of Willis or in the brain tissue, or there's any leakage of blood from damaged blood vessel in the blood vessels of the brain, the disease may be focal, affecting one area, or distributed, affecting multiple areas. So it's very important that the brain tissue receives enough blood supply containing all the required nutrients and the oxygen at all times to avoid one developing vascular dementia. Another type of dementia is frontal dementia. This one, like I have stated already, it accounts for 10% of the reported dementia cases. It is the type of dementia caused by degeneration of the frontal lobe of the brain. The degeneration may extend to the temporal lobe, characterized by accumulation of abnormal proteins in the brain. So what are we talking about under this one? There can be degeneration of the brain that begins from the frontal lobe, caused by certain proteins that are not good in the brain. It can spread to the temporal lobe. As it does so, it actually damages the neurons in the frontal lobe of the cerebrum, and also damages the neurons in the temporal lobe. And this leads to someone developing dementia. So because of the areas of the cerebrum affected being the frontal and the temporal parts mostly, hence the name being referred to as frontotemporal dementia. There's also dementia with Lewy bodies. This one accounts for 15% of the reported dementia cases. This is a progressive degenerative dementia characterized by the presence of cytoplasmic inclusions in nerve cells called Lewy bodies. These are actually proteins. Lewy bodies are found in nerve cells through the cerebral cortex or outer layer of the brain and deep inside the midbrain and brainstem. The location determines which brain function are most affected. Lewy bodies are found in the cerebral cortex of all patients with Parkinson's disease. So a number of patients with Parkinson's disease may be noticed to have Lewy bodies, and it may complicate to dementia. And in this type of dementia, out of someone having Lewy bodies, can be referred to as dementia with Lewy bodies. Its cause is unknown. However, it may result from complex interactions among different susceptibility genes and environmental risk factors such as head injury or exposure to certain chemicals such as pesticides. We also have mixed dementia. This is a type of dementia which has more than one type of dementia in them. For example, someone may have Alzheimer's and vascular dementia coexisting at the same time. Because you found two or more types of dementia in one patient, this type of dementia will be referred to as mixed dementia. Now, let's look at the signs and symptoms of dementia. So the main thing that we have noticed in dementia is that there is some brain tissue damage which brings about degeneration or deterioration in the intellect functioning and the cognitive skills. Eventually, someone fails to perform some of the activities of daily living. So after the progressive brain tissue damage, what do you expect in an individual as a sign and symptom? So in the early stages of dementia, people function relatively normal because the damage by then is not yet that bad, although they may survive with minimum support. As dementia progresses, more specific symptoms occur. These are difficulties with speech, which is aphasia. Remember, there's a damage to the brain tissue, leading to deterioration in the intellect functioning and the cognitive skills. Then you have someone develop difficulties with speech. There can be poor judgment. Remember the cognitive skills which are also deteriorated. And lack of insight. They can be difficult in activities of daily living performance, such as bathing themselves. Even dressing themselves becomes very difficult. Sometimes they may come out aggressive. At times, they may be uncooperative to what you are asking them to perform. Most times, they're unpredictable. This is true because of the damage to the brain tissue that impairs or deteriorates in terms of their intellect functioning and cognitive skills. Sometimes they can have agnosia, which is failure to identify objects. Sometimes they can also have some mood changes. Personality changes may take place, becoming irritable, suspicious, or fearful at some moment. They can be misplacing things, forgetting location of everyday items such as where are the keys, where is the wallet. They may present with all those signs and symptoms. Some of them might present with some hallucinations. Some of them go to an extent of having delusions. Some of them might have disorientation. They may be disoriented to time, place, even to the place that they were previously at. They may not be able to identify where they are. Recent memory loss. A sign of this might be asking the same question repeatedly. Point to note is that the behaviors are not as a result of deliberate attempts to be difficult or upset the carers, but it's as a result of damage to the brain tissue, which brings about impairment or deterioration in the intellect functioning and the cognitive skills. Now, let's look at the management of dementia. The first thing are the investigations. How do we investigate dementia in someone? First things first, history taking. This will review signs and symptoms of like being forgetful, difficulties in speech, aggressiveness at some moment, and being uncooperative. You can mention any. Then you can go further and do the mental state examination, which will review the level of the patient's mental state. We will rely on corroborative information from the relatives, as the patient is usually unaware of the extent of cognitive impairment. Remember, this is a psychosis where we say that actually it's a mental disorder characterized by disconnection from reality as a psychosis. So sometimes you also have to inquire from the relatives, especially those that have been living with the patient. They will give you a clear picture when they noticed and what they noticed as a deterioration in terms of the patient's behavior. Sometimes if the cause was maybe out of head injury, you can do some magnetic resonance imaging. This will reveal the extent of damage of injury either to the soft tissues or to the bones of the skull. Computer tomograph scan, abbreviated as CT scan. This will also reveal the presence of brain tumors, blockage, in terms of maybe blood clots in the serous arteriosus, blood vessels, or inside the brain, or maybe damage to any of the tissues. So the computer tomograph scan will review all those. Because one of the causes is actually HIV and AIDS, you can also do an HIV test just to rule out HIV infection. You can also do some full blood count to rule out the presence of any infection. Those are the investigations that can be done in someone with dementia. Now let's go to how we can treat someone with dementia. Let's begin with non-pharmacological aspect. For behavioral and psychological symptoms of dementia, if symptoms are moderate to severe and impact on the person's quality of life or function, medication may be needed, often in conjunction with non-pharmacological interventions. The person with dementia, the family and carers will need much support. So when you're attending to the patient with dementia, you also have to bring in the aspect of attending to the relatives. Because when you're not there, as you send the patient home on medication, those relatives must know how to handle the patient. So you must educate both the patient and the caregivers of the same patient on how to handle this patient. Counseling to help them understand and cope with what can be a distressing illness in the family should be done. So a problem-solving approach that is preventative rather than reactive may help to identify situations that trigger a particular behavior as they go back home, which can then be avoided or modified. If you have noticed together with the caregivers that when this person takes excessive alcohol, they start developing these signs and symptoms, meaning that there should be a therapeutic communication between you, the health staff, and the caregivers together with the patient to see to it that the patient stops drinking alcohol, which triggers the behavioral change in the patient. That's non-pharmacological treatment we're talking about. So communication strategies will include using clear, plain language and short sentences that convey one idea at a time. You must tell the caregivers that they should be able to communicate in plain language, not in a suspicious way. And they should be able to use appropriate short sentences, but they must be able to convey the message in that short sentence to avoid this patient with dementia getting suspicious. We will use gestures, pictures, and body languages to enhance the effectiveness of the message. That will help in being clear in the kind of communication that is being done. Now let's go to the drugs that can be used in the management of a patient with dementia. The treatment will depend on the condition of the patient, because sometimes we say they can be aggressive, sometimes they can go a little bit depressed, they can be uncooperative. So that's why we're saying treatment, it depends on the condition of the patient. So currently there is no cure for dementia. But drugs such as cholinesterase inhibitors, for example, donepezil, galantamine, or rivastigmine, may help to slow the progress of the disease in the early stages. Memantine, which inhibits the release of glutamate, glutamate is a neurotransmitter, is indicated for more advanced disease and may be used in conjunction with a cholinesterase inhibitor like galantamine that will help the patient. So we are saying when the disease has progressed severely, then pick memantine, which will inhibit the release of glutamate, which is a neurotransmitter. Memantine should be used in conjunction with any of the cholinesterase, for example, galantamine. Then at least you get the expected results. Now let's look at if you're using galantamine. So galantamine, you initially give 4 milligrams orally twice daily. Then after a minimum of 4 weeks, you increase the dose from 4 milligrams to 8 milligrams twice daily. Then after an additional 4 weeks, you may increase further the dosage from 8 milligrams to 12 milligrams twice daily. Then you can put this patient on a maintenance dose of at least 12 to 24 milligrams per day, given in 2 divided doses, meaning that 24 milligrams is the maximum dosing for galantamine. Mechanism of action of galantamine. It actually blocks the normal breakdown of acetylcholine. Side effects, to mention but a few, you have vasodilatation, pupil constriction, slow heart rate. Sometimes if the patient has developed hallucinations, delusions, and some physical aggression, you can use antipsychotics. That's why I've said the treatment or the management of a patient with dementia depends on the condition of the patient. So when the patient is aggressive, has developed hallucinations, delusions, we can use antipsychotics. Antipsychotics medication is most effective in the treatment of psychotic symptoms, which I've just mentioned. So a drug that we can use there is haloperidol, 10 milligrams, BD or twice daily. Side effects, you have sedation, dystonia, akathisia. Mechanism of action, it blocks the production of D2 receptors in the mesolimbic system. Contraindications, please avoid in patients with vasogangrene disease, such as Parkinson's disease. So don't give haloperidol if the patient has mentioned to you that they actually have Parkinson's disease. Next in consideration is that administer Aten to prevent extrapyramidal side effects of haloperidol. Those are examples of extrapyramidal side effects. You have tremors, flared speech, dystonia, and anxiety, to mention but a few. If the patient's mood has changed, maybe that time they were aggressive, this time around they go a bit depressed, they show you some signs and symptoms of depression, mood stabilizers can be given, like imipramine, which has a trade name, tofranil. The dose is 25 150 milligrams once daily. Side effects, you expect to have dry mouth, constipation, tachycardia, hypotension. Mode of action for this drug, it affects chemicals in the brain that become imbalanced or unbalanced in people with depression signs and symptoms. That's why at some point you may find medical personnel using imipramine to treat depression. And I still emphasize that the treatment of dementia depends with the condition of the patient. Precaution when you're giving imipramine, avoid drinking alcohol and other medicines which makes one sleep. Nursing implication, encourage the patient to drink a lot of water, encourage patient to have enough rest. Supportive medication. We can give folic acid 5 milligrams once daily for a month. It should be given simultaneously with vitamin B12 tablets, which is also given once daily for a month. This improves the condition of the brain. Let's go to the nursing management. Under the nursing management, we'll just discuss the few specific nursing interventions that can be done in someone with dementia. What are the aims? To help the patient improve their memory, of course, because I've noticed that here there is damage to the brain tissue, which has led to the deterioration of the intellect functioning and also cognitive skills. So we would love to see to it that there's an improvement in their memory. To promote the person's engagement with their social and support network. Develop a relationship with the person based on empathy and trust. You can actually use Peplau's nursing model here, which talks about nurse-patient relationship to develop the relationship with the person based on empathy and trust. What sort of environment do you expect to admit the patient with dementia? Remember, they are aggressive. Sometimes they go in a depressed mood. At times they are uncooperative. At times they have delusions. To some extent, they develop hallucinations. So what sort of environment do you need for such patients? We will admit the patient to a psychiatric ward or annex, of course, with maximum monitoring to prevent the patient from getting lost. Remember, these people, they are mostly not oriented to time and place. We will remove all harmful objects that can damage or endanger the patients and the others around. Remember, we said sometimes they become aggressive, they become uncooperative. We will nest the patient in a clean, well-ventilated room to promote free air circulation. We will put orienting cues such as calendar, especially if they are able to read, and a clock in a patient's room to promote orientation. Remember, we mentioned that they lose orientation to the surroundings and time. Psychological care. We will introduce myself to the client and the significant relations to create a nurse-patient relationship. Remember, we mentioned that these patients are actually suspicious at some point. So to reduce that, to promote trust in them, or introduce ourselves, or explain the condition to the patient and relatives to improve the knowledge levels about the condition, or further allow the patient and relatives to ask questions and will answer them promptly. These questions will be pertaining to dementia and its management and whatever procedures we're doing on them. This will help fill the knowledge gaps that were initially identified. We'll also explain each and every procedure that is done on the patient to promote cooperation. We will not argue with the person or the patient because the brain of the patient with dementia tells the patient that he or she cannot be wrong. So an argument with them may bring aggressiveness. We need to ensure also that they rest. We will minimize noise during the night by switching off the television as to allow the patient to rest if at all the ward has a television. We will perform all nursing care activities in blocks to allow the patient or to avoid disturbing the patient, thereby allowing him or her to rest. Observations. What kind of observations does a nurse need to do on a patient with dementia? We will perform a mental state examination on the patient to ascertain her memory level of the immediate, recent, and remote memory. We will do routine vital signs observations to rule out any abnormalities such as increase in temperature, rise in the blood pressure. Because remember, any rise in the blood pressure, it may cause some rupture of some blood vessels in the brain, further leading to ischemia, which will further damage the brain tissue because of ischemia. We'll monitor the patient's compliance to medication to improve their adherence. Yes, of course, because they'll be taking medication for some time. So monitoring the patient's compliance to medication is very vital in this case. We'll observe the general physical health of the patient and her nutritional status to improve the nutritional status of the patient. Observe the feeding pattern of the patient and ensure at least there is food intake to avoid the patient losing weight. How about nutrition? We'll allow the patient to eat the food of her choice or his choice while emphasizing on the balanced diet to promote food intake. We'll encourage the patient to take a lot of fluids to prevent dehydration. Exercise, of course. Sometimes they are aggressive, they are depressed. We'll advise the patient to perform active exercises to promote blood circulation, thereby preventing deep vein thrombosis. Remember, if there's any thrombus forming in the blood vessels in the brain, then there'll be some areas of the brain getting ischemic, and that will lead to damage to the brain tissue that will be lacking blood supply. We'll allow the patient to move freely within the psychiatric unit to promote good muscle tone. How about hygiene? If the condition worsens or deteriorates, I will help the patient to do daily activities like bathing them to remove dead bacterial tissues. I will help them brush their teeth or do oral care to alleviate halitosis or prevent halitosis. You can help them do hair care to prevent pediclosis, and also help them to look presentable and clean at all times. That promotes the good hygiene. What advice can you give to the patient and the relatives? Who advise the relatives not to leave the patient unattended to prevent the patient from wandering away from home after this, meaning that every time there should be someone with this patient. Who explain the condition of the patient to the relatives to promote cooperation, psychological care, and support to the patient, and the relatives will be given. Who advise the relatives to select a treatment supporter for the patient to monitor the patients during the time of medication. This will help so that the patient does not miss any dosing of the drug. Communication strategy to this patient is very important. So what are we going to discuss with the patient and relatives? Communication strategy should include using clear, plain language. No jargon language should be used to this patient. And ensure that these sentences that are produced to this patient are short, but they must convey one's idea at a time. Use of gestures, pictures, and body language can enhance the effectiveness of the message. It is helpful to use the ABC model. What is this ABC model? We're saying A stands for activating event. What happens before the client reacts? You must notice. You must assess. Behavior. How does the client react to the stimulus? C, we mean consequences. What happens after the behavior? As a nurse or relatives that stay with this patient, they must be able to use this ABC. Documenting these can provide clues to pattern and the triggers of behavior. So in summary, in this tutorial, we define dementia as simply a disorder in which there is deterioration of intellectual function and other cognitive skills, leading to a decline in the ability to perform activities of daily living. We also stated that there are four elements that will lead to the definition of dementia. They can be global impairment, they can be severity, decline. Those are some of the elements that will lead to the proper definition of dementia. We also looked at the causes. One of them, we actually said HIV infection, head injury, as Myers disease, to mention but a few. Then we further discussed the types of dementia. And the most common type amongst the patients for dementia, we actually say it is as Myers dementia. Amongst them, we also discussed mixed dementia. We went further to discuss the other remaining types of dementia. We also looked at the signs and symptoms of dementia. Some of them are aggressiveness, uncooperativeness, loss of memory, just to mention but a few. We looked at the investigations that can be done. We say the history is very cardinal. History taking, which might review forgetfulness. You can also get history actually from the relatives, especially those that have been living with the patient for some time. At least they'll be able to tell you when the changes began to take place. You can also do mental state examination. Computed tomograph can be done, especially in the suspicion that maybe there can be a clot in the blood vessels of the brain, or maybe there can be some soft tissue injury in the brain. Magnetic resonance imaging can also be done. Even HIV testing can be done to rule out HIV infection, even some full blood count. Just notice if there are any bacterial infections that have set in this individual. We also went further to discuss the drugs that can be used in the management of the symptoms of dementia. To mention but a few, we can use antipsychotics, especially when the patient has developed psychotic signs and symptoms like delusions, hallucinations, and those behavioral changes. Today's tutorial was on dementia. Thank you so much for listening. Have a brilliant day.